Hello, everyone. We had a bit of a technology hiccup, but this is Sarah Hine, and I am the host for tonight for our Monday Night Wellness series, and I have our wonderful guest that comes on frequently, Dr. Michelle Massa, who is an MD and ND, owns her own amazing wellness clinic down in Jupiter, Florida, and she also happens to be a dear, dear, dear friend of my family and like a sister to me. And so we have a really hot topic tonight. It is hormonal imbalance for both men and women. And as we just get this kick off and right to the point, I also want to thank Dr. Massa because today's her anniversary. It is her 8th anniversary, and she is here with all of us. And so everybody blow her a kiss. So thank you for being here. And I'm so sorry for my technology challenges in the beginning. So Michelle, Dr. Michelle, what are some common hormonal imbalances that you see in your office, and tell us about these common symptoms that run with them?
All right, so common, I'll put the names to it because that's what most people know hormone imbalance is as PCOS, so polycystic ovary syndrome, perimenopause, menopause, hypo and hyperthyroidism, premenstrual syndrome, estrogen imbalances, so things like fibroids, hyperestrogenism, endometriosis, adrenal or stress-related fatigue, metabolic syndrome related to insulin, and low testosterone. You know what's funny is that most of these are related to women because men only really have one issue, which is usually the testosterone or the adrenal part of it, right? But us girls are very lucky. We get all the bad stuff.
Lucky us.
So some of the hormone imbalances and symptoms that we see would be, obviously depends on what the cause of it is, but heavy, irregular, or painful periods. So you see that obviously with your estrogen imbalances, or also with uterine fibroids or PCOS, vaginal dryness and breast tenderness, hot flashes, night sweats, so typical with your menopause. Weight gain, which can be all hormone imbalances, increase in fat and loss of muscle mass, so usually also with hormone imbalances, and low testosterone, osteoporosis, common in menopausal women, or low hormones, loss of sex drive, which could be both men and women, erectile dysfunction for our men, memory loss, brain fog, fatigue, mood swings, anxiety, depression, heart palpitations, indigestion, constipation, diarrhea, all the list goes on and on, acne, infertility, hair growth in places where you don't really want them, especially women, like your chin and your, cheek area.
Right.
We don't want a beard, right? Thinning of your hair, and loss of hair, and also insulin resistance or increase in insulin, which would lead to your weight gain, and fluid retention. So those are common things. Also, arthritis is a common one as well.
Really? It's interesting. Yeah. Some of the things that I did not even know were related to hormonal imbalances. And I'm just curious, for those of you that are on with us live, drop a 1 in the chat box if you or someone you know or care about has some of those symptoms. And it's funny because sometimes you'll get spouses on something like this because they're on for their, significant other because they're struggling. So look at the numbers blow up. It's crazy. So Michelle, how is microbiome related? Really, how is gut microbiome related to hormone health? Because that doesn't seem like it's possible.
Right. So actually, at the standard person, even the conventional medical doctor, when you think of hormone producers, usually they think of the glands of the endocrine system. So things like your thyroid, your ovaries, your testicles, your adrenals, as being the main producers of hormones. However, what we're seeing in scientific research is that the gut microbiome is actually the most important organ of the endocrine system. It's actually as powerful or more powerful than the endocrine glands. It produces and secretes pretty much every single hormone that your body utilizes, and it also regulates the expressions of these hormones. So in other words, your gut microbiome isn't just producing hormones, it's also telling the other glands of the body how much or how little of each hormone they should be secreting or releasing or creating. So really, it's the master conductor of hormones when you think about it. It also helps in It also helps in the elimination of excess hormones. So just to give you an example, like breast cancers and uterine cancers and uterine fibroids, which are usually caused by high estrogen, and also prostate cancer can be caused by high estrogen as well. Usually you'll see an imbalance in how that estrogen is being either secreted or eliminated, because again, it needs to be eliminated from the intestine, right, to go out. So the microbiome is in charge of that as well.
Wow. It's crazy how it's just all interconnected. And yet when you say it, it does make sense.
Yeah.
I mean, it does. The more that you just think about it from common sense standpoint. So can you give us some examples how this whole system works?
Sure. So I'll just run through a few different hormones just so you guys can kind of get an idea. So obviously we've talked about serotonin in previous videos, right? So that's one of the big ones. That 90% of our serotonin is actually produced in our microbiome. And serotonin is the master regulator, we call it, in this communication that's occurring between the gut and the brain. So usually what you'll see with low levels of serotonin is an altered mood. So an increase in anxiety and depression, because serotonin is our happy neurotransmitter. Right? It's what gives us, the good mood and the feelings of you can kind of take the world, have the world in your hands kind of thing. Right. You feel really good when you've got good serotonin levels and your mood is great. But what we see with low, is we see a lot of anxiety, a lot of depression, also changes in the peristalsis that happens in the intestine. So you'll see issues with gut motility. So, constipation or diarrhea, for instance. And also important to mention, serotonin is actually the precursor to melatonin. So low serotonin can actually lead to sleep disruption, because if you don't make enough serotonin, you obviously will not make enough melatonin, wow, which is what helps you stay asleep and go to sleep and get good restorative sleep, right? Another example would be norepinephrine and epinephrine. So these are your stress hormones, and these are actually produced in the gut, and they're produced by the bad bacteria. So usually when you're in an acute stressful state, and I'm talking about a true, somebody comes in with a gun into my house and I'm trying to, run out of the house. So cortisol gets released from the adrenals, but again, the master conductor, which is your gut, is telling the adrenals to release cortisol, because cortisol actually makes you run faster. It actually makes you see further, and it makes you hear better, but it shuts down your digestion and your metabolism.
Really?
And norepinephrine, because if you think about it, if you're in fight or flight mode, you don't want to be pooping in your pants, obviously, right? You want to be like, all your blood flow is going to your muscles. Exactly. That'll happen after the fact, when everything.
So sharks don't happen with hormonal imbalance.
Exactly. So when you're in that fight or flight mode, everything shuts down except for your circulatory system and your brain, the focus, because you're on the run. And that's why people are able to do these like amazing things when their adrenaline and epinephrine and norepinephrine are pumping. So you hear people like jumping fences or, running away from the dog and climbing a tree that they never thought possible. But that's because of that epinephrine and norepinephrine response. So the cortisol will actually make you run faster. Now the problem happens is when that stress response is a chronic thing. So an acute stressor, that's normal. That's what you want to happen, because that's going to prevent you from getting hurt or save you from that acute stress, right? But what we see is that when you've got this chronic stress or, stress that's happening constantly, and you get stuck in that state of chronic stress, that your bad bacteria flourish, and you actually make more norepinephrine and epinephrine, because that is actually made by things like E. coli, Campylobacter, Salmonella, which are considered bad bacteria when they overgrow, right? But you need them, because again, they help make those things when they're needed. But if you've got chronic stress and you have an overproduction of them, then you're stuck in that anxiety state, right? Mm-hmm. So that's not good, because that can lead to other issues such as chronic elevation of cortisol, which can lead to weight gain around the midsection, insulin resistance, blood pressure issues, blood sugar issues, cholesterol issues, insulin resistance, and then also what's it called, anxiety and depression that becomes a chronic thing, and then eventually adrenal fatigue. So because of the system being overworked. And it can also lead to leaky gut. So leaky gut being that hyperpermeability of the intestinal lining, which then leads to immune issues and inflammation and chronic arthritis and pains and everything. So it's this vicious cycle, right?
Wow.
So it's there to protect us, but when it goes crazy, things go bananas, and then that's when all your imbalances happen. So then that can also affect your hormones, obviously,
right?
Because it steals. There's something called the cortisol steal, which is when you've got chronic cortisol, elevation of cortisol, it actually steals from your thyroid and from your female and male hormones. So we'll see drops in testosterone, drops in estrogen, drops in progesterone, almost like menopausal states when people are stuck in this chronic fatigue, cycle, or chronic stress type cycle, sorry. Some other examples would be your sex hormones. And I'll focus on estrogen because estrogen tends to be the one that most women deal with, whether it's in menopause, estrogen, progesterone, really. So there's 3 different forms of estrogen. You've got estradiol, you've got estrone, and you have estriol. Estradiol is kind of the stronger estrogens, the ones that can be really good, but can also lead to cancers and things like that. Estrone is another one that is also a stronger form of estrogen. And it comes from things like drinking out of plastic bottles, so environmental estrogens, or eating foods that have estrogen injected into them or hormones injected into them. So those are your exogenous forms of estrogen, things that you don't really want a high level of. Those are the ones that can lead to cancers and things like that. Now, estriol, as we call it, is actually produced in the microbiome. And that's one of the better ones. That's the ones that can actually protect you, but also give you all the benefits of estrogen. So that I want to focus on that one particularly, because I feel like that's really what you see in a healthy microbiome. You'll see these really good levels of estriol. So when I do testing, I test for all 3 of those. And then we're able to see, where is the imbalance. Now, remember that the gut also helps to eliminate those bad estrogens. So if you've got a bad microbiome or a imbalance in the microbiome or dysfunction, you may notice that you retain those estrogens that are supposed to be eliminated, and you actually reabsorb them. So that's what leads to those higher estrogen levels, and then can cause issues like, your uterine fibroids or PCOS or endometriosis, which is very common in women.
Right. I have a question. When you say you test, how do you test?
Saliva test is the best way to test for hormones. But, it can get costly for some people. Also, urine is another way to test hormones. Sometimes blood will do. It's not as great, but it gives us an idea as to what the levels are doing. Not my choice, but people don't want to spend, hundreds of dollars on a saliva test, so they'll opt for the blood.
Right.
Which can be fine as long as you catch it in the cycle. But again, it's a serum level. It's not a tissue level. The saliva tends to give you a tissue level.
Right. Now, Michelle, I just kind of thought of this. I'm just going to throw this out there, because if it were me, I would ask this question. Especially, you're an MD, but you also do functional. And anything functional is usually, unfortunately, not covered by health insurance. They can get costly, these tests and stuff. It can cost the patient a lot of money. And so I've noticed, like when we talk with Dr. Sean Talbot, how, and is this true for you, where oftentimes when you get a patient that is struggling with these symptoms, you've fallen in love with the Amari brand, which we're going to talk about next. Do you find that oftentimes you'll have them start here first, and then if, it's not quite, getting the pinpointing where they're struggling, then you might do the tests? Or what have you found? Like what way do you test?
I mean, for the blood test, it usually is covered by insurance, and some of the saliva tests are covered by insurance.
Okay.
But it just depends on the person's insurance. So if it is covered, I'll order it. Gotcha. But if it's not, and the person wants to spend their money on the treatments instead, the Amari products aren't going to hurt them in any way. So I'm always like, well, try it. We'll see how it works. If you don't notice an improvement or a benefit, then we can always test later, right?
Which I love that. And that really leads us into talking about, let's share, this holistic solution. because that's, when people have these types of symptoms, I think this is what people really want to know. I do, like, what are some options to at least try on a more holistic level? And so can you share with us, first of all, why did you as a physician choose to bring this brand of Amare? You're very picky in what you do with your background. I know, because I know you personally. So why did you choose Amare?
Well, I chose Amare. Well, first of all, I mean, I used to create my own programs, basically, right? Using the appropriate ingredients and things like that. And I just found that Amare made it so simple because it really put everything together. All the stuff that I know has been researched for adrenal support, for hormone imbalances, for weight, for cortisol, all the things that we see in the research are in the Amare products. And it made it more affordable for patients, easier to take, because a lot of the times I would have so many products that the patient's like, I don't really want to take all this stuff. Like, it's just too much. And then it becomes a stressor. And the last thing I want to do is stress somebody out when that's what we're trying to prevent.
Right.
So, people get like, oh my God, when am I going to take this? And oh, I forgot it. And now and it's like this whole disaster. And then they're not getting better because they're stressed about the whole program to begin with. So this made it so simple. And I loved the fact that they were like beyond organic, right? That all of their products had scientific research behind each ingredient. And that really, what really made me want to use it is what it did for me. I mean, the benefits that it did that it made for me and my husband, I was like, I'm totally in, because I got to try the products obviously before I decided to start selling them in my practice.
Absolutely. And I think that your own personal testimony that you as a physician are a product of the product is so comforting, right? For your patients and for all of us listening. So.
Because I really try to practice, let's get to the root cause. And we know that the microbiome is so key. And Amare really focuses on the root, which is the microbiome, and the gut-brain axis, which is tied to everything. So it's a very easy and simple program to put people on. And for the most part, I'd say probably 99% of my patient population that's taking the products have had a benefit out of it. So, which makes me even more excited about it.
Well, I love this mental wellness chart that takes, the average person, or the disease status from 1 all the way to 10, which is like amazing, feeling amazing. Yeah. Can you share a little bit about, how you as a physician explain this, and your goal is to what? To increase, right, the numbers, to get towards that optimized health. Right.
So most people that go to the doctor are usually either stuck in that 1 through 3 phase or 4 to 6 phase, right? So we tend to, in the conventional world, we're already dealing with the disease status. So the focus is, what can I do to, help the symptoms of these particular things? In the conventional model, it's all about, let's do it, a pill for every ill, right? Whereas when you're looking at the microbiome and you're actually getting to the root of the problem, you'll notice that the numbers will start to increase because you're dealing with the root. So instead of just saying, oh, here's a Band-Aid for you, which is actually going to worsen your microbiome, and I'm not against medications. I think there's a time and a place for them, but it may be that you need a little bit of support from whether it's a thyroid medicine or maybe a little bit of a bioidentical hormone or something like that, to get you to the point where, you're feeling a little bit better and you're more motivated to try a holistic products, which is fine, or if you're on an antidepressant or an anti-anxiety or something like that, that you want to try the holistic products. You always want to talk to your practitioner before you do this, but you can start to increase some of the holistic products and then start to wean off of your antidepressants. So what I use this to really show my patients, like, I want to know what their goals are, first of all, because obviously I'm kind of coaching them in a sense, right? And guiding them and giving them tools to get them to that level. And so instead of focusing on the disease state, I want to focus on how can we optimize them, how can we get them feeling better so that they're more motivated to do more things to improve their health and optimize their health. So this is a great, most people tend to be in the middle, right? Fatigue, tension, brain fog. I mean, what you're seeing, they're bloated.
Right.
So ones on the red area tend to be more disease states where you're kind of, I mean, you need to make some serious changes if you're there. So.
Absolutely, absolutely. So let's get to the nuts and bolts of, one of the things we love to do here is obviously educate. That's the whole purpose of doing these, is just to educate people that you do have options. Try things more holistically first, instead of just being put on different types of medications. And so one of the books I know that you highly recommend, I highly recommend, is The Mind-Gut Connection by Dr. Emmerd Mayer. You can order this online off of Amazon. It's very inexpensive. And if you want a really in-depth explanation to this whole microbiome journey, these new discoveries that have recently been made, purchase this book. It's well worth it. Would you agree?
Yes, and there's actually so much research now. I mean, you can literally Google microbiome in any disease state, and there's a connection. So, when I went through residency, there wasn't really much of this whole I mean, I'm sure it was there, but it was kind of hidden. It wasn't out in the open. Now it's like fully out there, and we're getting more and more studies and more understanding as to how the microbiome, but there's still a lot to be done. So I think we're going to see, this is the future really of medicine. Is what we're going to see.
Which it's exciting to be a part of that as this mission of Amare. It's very exciting to know that we're at the forefront. So Michelle, you have these patients that come in and they're having all these yucky symptoms. Tell us your top picks that you love to recommend from your own personal experience and then the experience you're seeing with your patients.
So usually I'll start with the fundamentals. I mean, that's the flagship product anyway, but I really, really love this because it really deals with the gut-brain axis and, all three of them. That's why there's 3 products. So the mentobiotics, which helps to support the gut, but not only just it's phytobiotics and phytonutrients, all the things that you need to help support those good bacteria and to get that balance back, right? But it also has things like glutamine, and ginger, which helps the gut lining. So if you've got this leaky gut going on, which most of us do, because leaky gut is caused by a lot of things, medications, stress, so many different things, or foods we eat. I mean, there's so many things that can cause leaky gut. And this really helps to support that gut lining. So it actually improves absorption. And absorption is key because absorption helps to make a lot of your hormones, like your thyroid hormone. You need certain nutrients. And if you're not absorbing your foods, we need to work on that gut lining, right?
Right.
To help improve that. And then what it also does is it helps support the immune system at the same time. So the Mentasync is the immune system and the adrenal product, which helps to support cortisol levels. So if you tend to be a pretty high stress person, we want to get those cortisol levels down. So things like ashwagandha, which are adaptogenics, which help the adrenals, but also helps to open up, that signaling that's occurring between the gut and the brain through this axis, right? So that's what the Mentasync is for. The Mentafocus is focused more for the brain aspect, for the being able to focus better, psychological vigor, energy, things that, like for instance, an Alzheimer's patient would do wonderfully with the fundamentals because you're going to be opening up that area of the brain, the cognition part. So you'll see improvement in memory and in attention and focus, which that Mentafocus. But I love that they put it all together. What?
I love it. It's incredible. So you'd highly recommend this as like a beginning program.
And it's like a foundation. You want to really, because you got to have a good foundation, right?
Exactly.
So I always start with the fundamentals, and I usually tell people take it for about 90 days, and then we can tweak it, right? So depending on the person. The Menta Essentials line is great. I usually tend to gear towards, they're all wonderful products. The Vita GBX, the multivitamin, obviously, again, for those micronutrients, things that you need for hormone production. And now, multivitamins are great because they bridge the gap of what's lacking in your diet. So if you're not eating, enough vegetables or fruits and things like that, because we're supposed to have about 9 servings a day, which is hard to do, this bridges the gap of what's lacking. I do think it's important to get most of it from your food. Now, this is, again, a support, right? The omegas, which are great for inflammation. As we know, people that have leaky gut or issues in the microbiome in general with imbalances tend to have more inflammation. So as we talked about earlier, that vicious cycle where you end up with arthritis and things like that, the omegas are great for helping to support, you know, the inflammation cascade so that it decreases. But also it's great for your circulatory system. It's great for your heart. It's great for testosterone production because, again, testosterone comes from cholesterol. That's what actually makes testosterone. So you actually need those healthy fats to help produce the testosterone that you need, right? And so that's why things like salmon, things like that have high omegas, right? Salmon, flax seeds, those types of foods are really, really good for testosterone and hormone balancing, which is why omegas are great. So omega 3s and omega 9s are the key ones. Those are the less inflammatory.
And I know you love to recommend a few of the things in the Mentotherapeutics line for the you know, hormone
This is actually
balancing.
one of my favorite lines.
I agree.
Only because I love every single one of these products is amazing. The reboot, obviously, I recommend everybody do a reboot before they even start the fundamentals, because you know it only takes 3 days to reset the gut, and to get, you know, people think, oh my God, I've been eating so bad my whole life, and it's going to be so hard to do this. This is so simple. It's 3 days, and it really does help to get the microbiome balanced, so that when you get started, you're actually going to get better and better and better. And you'll get better results if you do the reboot first. The mood product is one of my all-time favorite. I use this a lot in my practice because obviously stress is a big thing, you know, that I see in people, but also for myself. You know, if I'm feeling overwhelmed, I usually take 2 in the morning. That's my standard dose. But there's times where, you know, the phone won't stop ringing. I've got people asking me a bajillion questions, and then things are coming at me from and I get a little bit overwhelmed, and I'll just say, you know what, I'm going to take 2 more mood. I know when I need it, or if I'm home with the kids and it's a stressful day and I just want to relax a little bit, I can sense myself getting into that stressful, you know. And if you think about it, stress is really, I mean, the definition of stress is that it's a perception, right? It's not real. Right. We actually react to the things that are happening in our mind. So you can control that with mindfulness techniques and things like that. But, you know, we tend to create our own stress. We stress about our list in the morning, or, you know, we make all these lists to check off the boxes, but then we stress about it and keep adding stuff to it. So we create this cycle of stress, and all of us live in stress. I feel like stress is one of the biggest things that we're seeing nowadays, right? With all the technology, even in our kids.
Totally. Do you see
the mood?
Go ahead.
No. So the mood is amazing because it decreases the cortisol level. So it actually makes you more resilient to stress. And it also gives you that serotonin, you know, that we talked about, that happy neurotransmitter that can help calm stress, can help you feel better, and decrease anxiety and those symptoms that come along with stress. So absolutely. I love that product. So go ahead.
Absolutely. No, the therapeutic line is absolutely amazing. And I know that you're also a very huge component of the GBX foods.
Wait, go back real quick, because I want to mention the relief. Sorry.
Oh, okay. Go ahead.
Which amazing for inflammation. Amazing. For anybody that suffers with PMS or cramping during their cycles, or also just inflammation, arthritis in the joints. This is a great product. It works really well without the side effects of your typical Aleve and naproxens and Tylenols.
Oh my gosh, I'm so glad you said that, because that is a huge pain, literally, for people. Yeah. I mean,
it's got you know, anti-cancer benefits too. I mean, turmeric is very well studied for lots of things, and I love it. And frankincense, I mean, you know, boswellia, all those are in that product. So it's a wonderful product. And sleep, obviously, to help with the serotonin and melatonin production. So those are great. And I do love my energy. I do take that regularly. Replaces your coffee, which is great. So cortisol support, microbiome health support.
Yes. And GBX foods, I know you call this your functional foods.
I do love this. I take a shake every morning. It's easy for me. I'm on the go, so I've got to be quick, and I make a shake in the morning. It's delicious. It's vegan, all natural. It's got all the things that people ask about, you know, like no soy, no dairy, no, you know, it's vegan, it's non-GMO, gluten-free, no artificial colors, all that stuff. So I love, love, love this product. And it's also a microbiome food because chickpeas are known to help, support those good bacteria, but it also has the benefits of decreasing cortisol. Again, all the products in the Amare line, I mean, they're really all amazing. And I use them depending on what the patient is struggling with. So if sleep is a big problem, obviously I'm going to be reboot fundamental sleep, right? Or if they want to lose weight, I'll do reboot fundamentals, mood, and basically the B3 program with mood added into it, right? If they're struggling with hormone imbalance, I'll say mood and fundamentals, because that's going to help with that hormone support as well as omegas, right? So just very individual plans depending on what the person is struggling with.
And it's so simplified. I mean, I can follow that. And that's what I love about this. And so I like to explain the GBX foods is we all have to eat it. And so no matter what a patient is going through, no matter what a person is struggling with, we need food. We have to eat. And so one of the things that I find is the most challenging for most people is finding super healthy foods that are very affordable, that are easy and quick, and they actually taste good. So I just love this because it's very, very affordable, because to find something that's ultra organic and healthy and safe and microbiome friendly, feeding all the right specific strains, it's hard. I mean, it's
I think it makes it easy for people because most people are on the go, so
totally. So I highly, highly recommend this. Which really brings us to the B3. You mentioned about the B3 program, which is all the products you just talked about, but it's just packaged literally in a package. So this would come with the GBX foods, the fundamentals, and the Vita GBX.
And the seed fiber and the greens.
Yep.
Yeah, because like we talked about before, diet is so important. The nutritional aspect is so, so, so important and so foundational to health in general, right? So having a high fiber diet is really, really important, but you want those healthy fibers like flax seeds and chia seeds and, things like that are going to actually help in hormone balancing.
Absolutely.
So I love the B3. This is what I did, and this is what I did the fundamentals to begin with because B3 didn't exist when we first started on her program. So I was on fundamentals for about a year, and then I added the mood. And then in November, I started the B3, which literally I think all together first it's put me in remission of my hypothyroidism. And I've lost 20 pounds since I've been on this since November. So the B3 I love, and my patients see it and they're like, what did you do? So it's a very easy program to sell because they've seen me go through the change in the last 3 months. So it's been awesome. I love it.
And Michelle, can you just share briefly like the results you're seeing in your clinic? I mean, it's impressive.
Weight loss, obviously. Thyroid health. I just had another patient the other day who also reversed autoimmune thyroid disease on the same program.
Say that again. She
reversed her autoimmune thyroid disease on the program. Hashimoto, same as me. Same thing on the same exact program. The B3 was the key.
Wow.
Because the microbiome is so important in all of anything autoimmune. The microbiome is key. So, there is hope for people who are struggling with autoimmune issues. I've seen reversal in arthritic pains just by healing the microbiome, just with not even adding turmeric, like just doing fundamentals.
Right.
We've seen that improvement because when you improve the gut, the inflammation cascade decreases and inflammation goes down in the whole body. We've seen kids with autism that their focus has improved significantly. People that were constipated, moving their bowels every day, hormone balancing, whether it's thyroid, cortisol, hormones, men with their energy and just feeling better. And, because the reboot again is a way to cleanse your liver also. And so liver is important to really get rid of all the toxins that are building up in our body, which can affect our testosterone levels and also our hormone levels in general. So it really has helped so many people in so many different areas. I mean, the list goes on and on, whether it's fatigue, energy, hormone imbalances, thyroid imbalances, weight loss, tons of different things, and autoimmune dysfunction improvement. So those are the big ones.
I couldn't agree more. And I love to hear the results, because I think you cannot placebo hormones. You just
Right.
can't. I mean, right? Like, it is what it is. And listen, without going in a lot of detail, I've had a lot of women reach out to me saying, I don't know what's in this stuff, but my personal life with my spouse is like phenomenal right now.
Because their libido increases.
Totally. And it's hilarious, but I've had more than one woman reach out to me going, what is in this? So it's insane how much it affects everything. And these are real issues that make people feel miserable. And
people think it's normal too, because it becomes their norm.
Yes. And honestly, when you feel better, you're nicer. You want to have relationships. Like, you're less likely to react and more likely to respond. And so just even relationships are
less
different.
Moody, a lot of less moody people.
Yeah. It's like, sign me up. So B3 program, we'll do a specific night on that as well. But listen, I want to first of all thank Dr. Michelle so much for all this knowledgeable, wonderful information. You can see why I love her so much. And part of the all-inclusive of Amare is our Sense program. It's not just supplementation. And Michelle, we really talked a lot about this, that, you know, it's also about what you exercise, your nutrition, your stress management, and your evaluation and, you know, process of it. So it's really an all-inclusive of teaching the average person how to take ownership to their health and putting the right tools and aids from all the different aspects of life and health. So it's a fabulous program. And so our goal is simply this: wherever you are on the spectrum, if you already are in that disease status, there's hope for you. And this is why I'm personally so passionate, because I have had a sick, you know, husband for 6 years, and I have lived with the importance of moving up on the spectrum scale. It's quality of life. Every number raised is adding quality of life to somebody. So if you're in that disease status, I hope that Dr. Michelle tonight shed some light and hope for you, that there is hope, and that, you know, in a short amount of time, a month's time, 2 months' time, you can really start to see some significant symptom increase or decrease and changes and moving up this spectrum. So how we want to close tonight is, listen, somebody cared enough to share this with you. And so we want to encourage you to go back and talk to that person. Or maybe you've been listening to this and your mind is like thinking of people that you would love to have them listen to this. Probably both. And that's great, because everybody matters. So whoever you're working with, go back to them. They're going to help guide you in what's right for you. And this has been recorded. It will be posted into the Gut Instinct page, so you can add your loved ones in there and take them into, and I know I say that funny, but I say it right. I'm just saying I say the word take right. But you can take them into this wonderful recording and let them listen to this. So your options, listen, is that we help you decide the path that best serves you. And so we have options to teach you how to get our programs and how to get, you know, connected in. And then we have programs in place to help people afford it, which is amazing. And then we also have programs in place for people that fall in love with these holistic solutions. And we are, you know, strategically looking for people to share this mission out into this world. Hardly anybody knows about Amare, and so many people need it. And we can't do this alone. Dr. Michelle and I need people. We all need people to spread this beautiful mission. So we have 3 amazing options within our entire program. And our favorite picks that Dr. Michelle kept referring to is the B3 program, all right? And the B3 program or the Fundamental Pack. And the Fundamental Pack comes in the B3 program. So these are like our top 2 picks for hormonal imbalance and really for a lot of health issues. Both come with a free reboot. Both come with subscribe and save 10% off rewards every time you order. So you actually can accrue points and get free stuff, which is great. And both come with a bundle and save. The 3 items you get half off, and both come with a free product. for joining for the first time. So these are just fabulous, fabulous programs that you can talk to about the person that sent you here. Reach out to them. They'll be reaching out to you. And last but not least, I just want to encourage this is joining our community. One of the big lessons I learned going through a long-term chronic illness in a stressful situation, exactly what Dr. Michelle talked about tonight, was feeling isolated. And part of healing is not being isolated, but being a part of a community and hearing other people overcoming, rewriting their lives, that that's not their story anymore. I had found a couple support groups for my husband's disease, and sometimes they help, but most of the time it was more depressing because it was more like people stayed stuck on the symptom and stuck on the disease than they did overcoming it. And I want to help people rewrite their lives and overcome it. And so we have an amazing couple of communities on social media that you can join. Our Gut Instinct page is amazing, and this is where this will be posted. Amari also has one called Fundamental Wellness, Be Well. Great testimonials in both, educational resources in both, and just a chance for you to not feel isolated. And we also recommend doing local mind break community events, forming, your own group of 3 to 5 people or 5 to 10 people and meet like once a month. And people are doing this, they're beginning to do this all over the country and just sharing what they're going through, how they're feeling, what's working, what's not, and implementing these programs. And I'm telling you, that in itself is healing. And so we really want to, encourage community, because I think it's needed more now than ever before, because we've gotten so away from social interaction. And that's also very important. Just getting together with some friends and laughing is healing. And I know, because when I get together with Dr. Michelle and her husband, it's like, it's just a hoot. We have a great time. And laughter gives you that endorphin rush. So these are just some tips and suggestions. We want to thank you tonight. Again, Michelle, we want to just sincerely thank you from the bottom of our hearts.
No problem.
You have such a busy schedule, and it's your anniversary. So go be with your husband. Thanks for all of you joining us tonight for the first time. We hope to have you back. And you guys all have a beautiful evening. Thanks again, Michelle.
Bye.
Good night, everyone.